this morning is Ram Shrestha. He's forgiving me for mispronouncing his last name. Everyone was laughing at me, but we know him as Ram. And Ram is the Senior Quality Improvement Advisor for Community and Nutrition at URC. He's a nutritionist and with over 20 years of experience in developing countries. Ram is well known for his work developing and implementing successful community-level interventions. He has been recognized by the Global Health Council, Time Magazine, Tufts University, and the Public Health Association of Nepal for his work. He also was an original staff member of the IYCN project. Fortunately, he left for Nepal before I came to the project, but he's been a friend of the project ever since. Today, he will discuss strengthening community quality improvement by utilizing community health systems networks. Ram.
Thank you. Thank you very much. It was really a pleasure to have opportunity to talk about or share something about these community health workers. And I'm really glad to hear from many countries talking about how the program has been really implementing using different groups at the community level and health workers and how they are making the program success. It was really very good for me to hear that, because that's how I started my career. I started working in different programs, working in Nepal with vitamin program, working in Afghanistan, using this pictorial growth card in Indonesia, Cambodia, and then moved back and started working in African countries to hear how things have been going there. So it was it's really nice to hear that. But one other thing I'll just share with you that like I have worked like a scaling up vitamin program, IMCI program, iron intensification program, right? Using the community volunteers, health workers. Over the time, now what I'm feeling that there are more than that. We really have to go a little bit beyond those things, because we have been talking for a long time. Incentives, support, salaries, and all those kind of things, right? And over the years, to me, it seems that we have to go a little bit beyond that. So that's what I will be talking about. How could we do that? What is my experience on that? So one of the things I just wanted to, I hope you can see that. One thing I just wanted to make sure that we're talking about community, right? What I think, is a community, right? So to me, when I say community, I always see villages, cows, a small road, muddy things. For me, that's the community, right? Where children are playing on the ground. Some of them are malnourished, well-nourished. Mothers are doing breastfeeding. So that picture is for my community, right? I hope for a minute, just think, your village, places, and that's what I will be talking about. So that's what I wanted to make sure that we are in the same place. Everybody knows that when you talk about community health worker, this is what we talk. We say they should be the member of the communities, they should be answerable to the communities, supported by health system, part of the organizations, and then we talk about all these kind of things, right? So think about the community health worker you were working with, see where they falls, right? Just to let you know that. And then what I want to see that, if that kind of thing, then I just wanted to share with you when I started working with the volunteers in Nepal, right? And then what we learned over the years. What we saw that, here is we have a lowest unit, health post, right? And within that health post, we have a community health workers. And that community health workers is supposed to provide services to all these households, right? Was it possible? No, right? So they came up with the idea that let's have a few volunteers, right? And they started with this volunteer reaching all these households, right? Was it possible? Again, no. So they said, let's go a little bit further, let's take our health services a little bit further, and they came up with the idea of outreach screening. So I'm just giving you how we are moving, right? So we came with the idea of outreach screening. So we have an outreach clinic close to the community, but still we are facing the same problem, right? Still we are hearing same thing. The volunteers are not motivated, they don't get the salary, all those kind of things, right? So if you look at the program, I think in most countries, right, this is where we are really struggling. Right? We are doing our program, we are doing our best, but that's where we are struggling, right? So that gave me an idea, and then I started thinking that, here people say, now everybody says that they, community health worker, volunteers are very crucial. They have done a lot of things. They have really contributed, right? But, how far we are, right? Where we are now, right? We're struggling with the same things what we were, a long time ago, right? And then again, we come back and look at the last sentence we say, look, if we don't have our communities involved in that, it's really vulnerable. What does that mean? What we are talking about? So here I just wanted to say that, what we saw with all this kind of thing, that, what is happening in the community, what we are not learning, what's happening there. Right? So then again I just said, people really talking about, are they motivated? Some programs say yes, they are motivated. Some programs say no. Some programs say let's give them salary. Some says incentive, cash or in kind. We have been struggling, task shifting, and then we say let's have more volunteers, let's have more workers, right? So we are going more and more and more. I don't know how far we will go, right? In one country, we started with the extension worker, going to the volunteers, going to the model family, going to the the volunteers artists, right? So now question, how far will we go? Should we keep on adding? Right? Maybe the day will come when everybody will be the volunteer. So anyway, so that's I'm just trying to give you the environment where we are working. What is the environment we are working on, right? So that we'll think of what should we do. So I'll just and then people are just asking questions. What works? What are the problems with the CSW programs, right? What do you have in a community, right? And then I will tell you a little bit now, right? These are the questions people are really struggling and trying to find out, including WHO, World Bank. Everybody is going and saying, let's have, let's look at this, right? But I'll just focus a little bit on, if you go to a very, lower level and look at it, there are very simple solutions that can really help you to achieve that. You don't have to look for very big, high technical solution. That's what I want to share with you. So this is the example I used. This is from Nepal. I used to, when I implemented program in Nepal, and we were mobilizing almost still, 49,000 volunteers have been working in Nepal for more than 20 years. Right? Are volunteers motivated? Can they work? I don't know. They are working for 20 years, right? So anyway, so the question always used to ask me why they are motivated, right? Why this is happening, right? Some people are saying that, oh, Nepali are very nice. but I'll tell you, before 1993, when we started the program, we used to have same kind of questions. The government saying that volunteer doesn't work. We need to pay for them, right? But after that, now you go and talk to them, they say, no, volunteer works, right? So it has really shifted, right? But it took a long time to do that. So it doesn't happen within a short day. What I'm trying to show here, that, and this is the answer of most of the questions. What I'm saying that, if everybody points to the volunteer, right, and make them do it, it's not motivating. It's not sustainable. She cannot do it, right? And this is what it shows this part. Keep on adding programs and hope that volunteer will do it. No way. It doesn't matter even if you give her a lot of money. It doesn't work that way. Give any incentives, it doesn't work. Physically, she cannot do it. But look at the other part. If you look at that one, if you provide support, right? It doesn't have to be money, right? If you provide support, then she can hold the program. Right? And I think this is very simple concept, but it has a lot deeper meaning on it. Right? So just focusing on that, what we did, we developed a concept. Right? So I'm just developing a concept now, and that concept, I say that it's not a volunteer, but we have to work in the system. So at the community, we have to look at the system, and then we have to work through that system. Right? And what is that system? So let me tell you. Suppose these are the different households in a village we really want to reach with the volunteers. Suppose there is a one group, say saving and credit groups. This group has linked with almost 20 to 30 households. Here we have another group, school, that is linked with almost 20, 30, 50 households. Where you can really reach, you can get information and you can provide information. Here we have religious group. Every Sunday they meet. You can send information, get back the information. Right? Here you have women's group, through which you can give the information, you can get back the information. So with this kind of group, if you really work, and they are working there, whether you use them or not, they are already there, they are working there, and they are working with the same women you are working. Right? So we look at, when I look at the village, this is how I see it. And I see that there are different groups, right? That can be, they are already reaching the households, right? So we just have to be integrated. We talked a lot about integration, right? Just a matter of putting things there, right? And then what we're saying that, so each group will talk. If you want to know, say, how many children are unionized in members of this women's group, just ask them. When they have a monthly meeting, just ask, raise your hand, how many household doesn't have unionization. You got there, right there, right? And have a record, just have it. Every month, the community health worker will come and collect it. Or you can have a system, or look at a system where there is a representation from all these groups. Right? Will meet together every month, and you will find it. If you look at in a village, you will have some kind of committee, either health committee or social committee, traditional committee, some kind of committee is there. For example, say in Ethiopia, if you have a leader who meets there, right? You have a religious group, they meet every Sunday. Right? So use some of the groups, and if you look at, most of the women will be the member of that. Right? So what we are saying that, if you have a committee like that, if you have a representation from that committees, and within this group, if you make them to discuss about health at least for a couple of hours when they meet, right? Then what you are doing here, you are using the system which exists in the community. You don't have to create a system, you don't have to add a person, you don't have to spend a lot of money, but you will get all the information. You can involve all the people. You